Welcome to Key to Pharmacology. I am Dr. Sehrish Zaffar, and those who are new here, I am an Associate Professor of Pharmacology at CMH Lahore Medical College. Continuing with the AUTOCOIDs, the next topic in line is prostaglandins. Do not miss this video because we often get important exam questions like clinical uses of prostaglandins, what are the synthetic prostaglandins, and so on. Before we hop on to prostaglandins, हमें ये पता होना चाहिए कि eicosanoids क्या होते हैं. Eicosanoids are basically oxygenation products of polyunsaturated long-chain fatty acids. In simpler words, ये arachidonic acid के derivatives होते हैं या फिर linoleic acid या फिर eicosapentaenoic acid. These are generally found in the membrane phospholipids in the cell membrane. इनके साथ होता क्या है कि एरिकिडोनिक एसिड से कुछ ऐसे प्रोडक्ट्स को डिराइव किया जाता है which are called eicosanoids and they have got certain physiological effects. Most of the time they act where they are produced or in the surrounding area. That is why they are called AUTOCOIDs. तकरीबन हर organ जो है वो अपने prostaglandins eicosanoids जो है वो synthesize कर सकता है. The reason being every single cell has got a cell membrane and the cell membrane has phospholipids in it, and these phospholipids are broken down to produce the prostaglandins or the eicosanoids or the AUTOCOIDs that we are talking about. This includes majorly prostaglandins and leukotrienes. Mini-Katzung summarize करता है all the drugs which are covered in the chapter of the prostaglandins. Eicosanoids generally is the broader term which is further classified into leukotrienes and prostaglandins. Importantly, we also have eicosanoid antagonists that are being used clinically, which includes leukotriene antagonists such as dilutin and zafirlukast, and we have the prostaglandin antagonists such as corticosteroids and NSAIDs, commonly known. Looking at the synthesis of prostaglandins, we can see that the membrane phospholipids are broken down by the enzyme phospholipase A2 and arachidonic acid is derived. This arachidonic acid further undergoes either the lipoxygenase pathway to form leukotrienes or the cyclooxygenase pathway to form the prostaglandins. कुछ cytochrome mediated reactions भी होते हैं which produces the epoxy eicosanoic acids, but these are not used clinically, hence not discussed. Breaking down further, अगर हम देखें कि cyclooxygenase pathway में क्या होता है, we have got two enzymes COX1 and COX2 which convert arachidonic acid into prostaglandin G2. ये G2 बहुत अनस्टेबल प्रोस्टाग्लैंडिन होती है और ये H2 में कन्वर्ट हो जाती है. H2 is then further converted into multiple other forms as we can see D2, I2, F2 alpha, E2, thromboxane A2. The green ones remember कि ये वो प्रोस्टाग्लैंडिन्स हैं जो इफेक्टिवली फिजियोलॉजिकल एक्शंस को प्रोड्यूस करती हैं और जिनके सिंथेटिक एनालॉग्स को हम क्लिनिकली यूज़ करते हैं. On the other hand, if arachidonic acid undergoes the lipoxygenase pathway, 5-lipoxygenase is the key enzyme which mainly forms leukotriene A4, which again is an unstable compound and is converted into leukotriene B4 and C4. C4 is then further converted into D4 and E4. Pharmacologically, if we can see, all of the prostaglandins act through G protein coupled receptors. But we can see that there is a variation. Some of them are GS coupled, some of them are GQ coupled. One of them is also GI coupled. इसकी वजह से एक major difference produce होता है on the effects that is produced. Broadly speaking, हमारे पास PGE2 और I2 के similar effects होते हैं. And they are marked in green because they are generally beneficial effects. PGF2 alpha and thromboxane A2 mostly produce similar effects on the organs and generally speaking these effects are deleterious to the body. We will see how. हम देख सकते हैं कि vascular tone को अगर हम देखें तो PGE2 and I2 are going to cause vasodilation, whereas PGF2 alpha and thromboxane A2 are going to cause vasoconstriction. Bronchial tone को अगर हम देखें तो PGE2 and I2 are going to cause bronchodilation, whereas F2 alpha and thromboxane A2 are going to cause bronchoconstriction. Bronchoconstriction can never be यूजफुल. यूट्राइन टोन को अगर हम देखें तो E2 का मिक्स्ड इफेक्ट है. यूट्राइन टोन पे PGI2 का मेन इफेक्ट है that it causes decrease in the uterine tone. On the other hand, prostaglandin F2 alpha and thromboxane A2 cause strong uterine contractions which can be very dangerous, especially if the patient is pregnant, because this can induce abortions. Looking at the platelet aggregation, mainly PGI2 is an inhibitor of platelet aggregation and maintains our blood in the fluid form. Hemostasis को maintain करती है. It is a good prostaglandin. Thromboxane A2 on the other hand causes platelet aggregation. While this is also important for the normal clotting mechanisms, but if this goes overboard तो इसकी वजह से बहुत सारे thrombotic events हो जाते हैं, and that is the reason कि thromboxane A2 के antagonists को हम use करते होते हैं as antiplatelet drugs. Leukotriene chemotaxis is mainly dependent upon the leukotrienes. We can see here कि leukotriene B4 का maximal role है in chemotaxis. Now talking about the pharmacological actions organ wise, अब हम देखेंगे हर सिस्टम पे डुअल इफेक्ट्स प्रोड्यूस होते हैं बिकॉज वी हैव ऑलरेडी कैटेगराइज्ड प्रोस्टाग्लैंडिन्स इनटू प्रोस्टाग्लैंडिन E2 I2 विच जनरली प्रोड्यूस गुड इफेक्ट्स एंड प्रोस्टाग्लैंडिन F2 अल्फा एंड thromboxane A2 विच जनरली प्रोड्यूस not so good effects. Vascular system में अगर हम देखें तो thromboxane A2 and F2 alpha are going to cause vasoconstriction, whereas PGE2, I2 and D2 are going to cause vasodilation. Gastrointestinal system में E2 and I2 are going to decrease the acid secretion, increase the mucus secretion and prevent the formation of peptic ulcers. They are also called gastroprotective prostaglandins. F2 alpha on the other hand increases peristalsis, causes diarrhea and colicky pain. In the airways, thromboxane A2 and prostaglandin F2 alpha cause bronchoconstriction. The leukotrienes C4 and D4 also cause bronchoconstriction, but E2 I2 prostaglandins cause bronchodilation. In the platelets, thromboxane A2 is a strong platelet aggregator, whereas prostacyclin, which is also called PGI2, is an inhibitor of platelet aggregation. Prostaglandins का kidneys का role बहुत important है. Why? Because kidneys की जो auto regulation है blood flow की वो prostaglandin dependent है, especially E2 and I2. They cause renal vasodilation, they promote salt excretion, they increase the medullary blood flow. Loop diuretics, they increase the production of renal prostaglandins और ये एक this is one of the additional mechanisms जिसकी वजह से वो decrease करते हैं blood pressure को, because renal ब्लड फ्लो की रेगुलेशन इम्प्रूव कर जाती है और प्रोस्टाग्लैंडिन मीडिएटेड वेसोडाइलेशन एंड सॉल्ट एक्सक्रीशन जो है उसको एडिशनली लूप डायूरेटिक्स यूज कर लेते हैं इन प्रोड्यूसिंग द हाइपोटेंसिव इफेक्ट. वी कैन सी दैट प्रोस्टाग्लैंडिन F2 alpha and low doses of prostaglandin E2 are going to cause contraction, whereas high doses of prostaglandin E2 and prostaglandin I2 are going to cause relaxation. Prostaglandin E2 specifically produced in the hypothalamus is responsible for fever. There are certain prostaglandins such as prostaglandin E and F derivatives that are known to decrease the intraocular pressure by unknown mechanisms, but presumably they increase the drainage of aqueous humor and hence they are used in the treatment of glaucoma. फार्माकोलॉजिकल एक्शंस जब हम अंडरस्टैंड कर लेते हैं, वी नो कि कुछ प्रोस्टाग्लैंडिन्स जो है वो ऑपोजिट इफेक्ट्स प्रोड्यूस कर रहे हैं टू ईच अदर, एंड वी नो कि हर सिस्टम में क्या क्या पॉसिबल इफेक्ट्स हैं जो प्रोड्यूस हो सकते हैं. सो क्लिनिकल यूजेस को अगर हम डिवाइड कर लेते हैं सिस्टम वाइज, फर्स्ट ऑफ ऑल टॉकिंग अबाउट द फीमेल प्रोडक्टिव सिस्टम, प्रोस्टाग्लैंडिन एनालॉग्स आर कॉमनली यूज्ड फॉर इंडक्शन ऑफ एबॉर्शन, फैसिलिटेशन ऑफ लेबर और पोस्टपार्टम हेमरेज. मिसकैरेज अगर इंड्यूस कराना हो, मेडिकल टर्मिनेशन ऑफ प्रेगनेंसी अगर कॉज करनी हो तो डायनोप्रोस्टोन, मीजोप्रोस्टल, प्रोस्टाग्लैंडिन एनालॉग्स हैं विच आर कॉमनली यूज्ड इन द फॉर्म ऑफ वेजाइनल टैबलेट्स. It is very important clinically to note this, that medical termination of pregnancy can only be induced before 13 weeks of pregnancy. After 13 weeks, surgical termination is advised because of high risks associated with the medical termination. At the time of labor, prostaglandins, because they increase the uterine contractions, तो facilitate करने के लिए भी labor को उनको administer किया जाता है. Sometimes for the induction of labor, sometimes for the facilitation of the labor, prostaglandins साथ में administer किए जाते हैं. Also, after the baby has been delivered, postpartum hemorrhage, the bleeding that continues after the delivery, अगर वो बहुत excessive हो तब भी prostaglandins दिए जाते हैं because they cause vasoconstriction and they cause uterine contraction, thereby they decrease the postpartum hemorrhage. In the male reproductive system, Alprostadil, which is a prostaglandin E1 analog, is commonly used for the treatment of erectile dysfunction because of its vasodilatory properties. Cardiovascular system में Alprostadil is used to keep the patent ductus arteriosus open. अब हमने अगर ductus arteriosus एक पेशेंट में, एक न्यूबॉर्न पेशेंट है, उसके अंदर ductus arteriosus को जनरली नॉर्मली क्लोज हो जाना चाहिए. Why would we want to keep it open? because there are certain cases जिनमें transposition होती है great arteries की, जिसकी वजह से the patients are born with cyanotic heart disease, और अगर ductus arteriosus को open ना रखा जाए तो the only connection between the right side and the left side of the heart जो normal connection है उसको disturb कर देते हैं. We have to keep it open until the surgery is performed and the heart anomaly is corrected. So to keep that ductus arteriosus open, Prastodil, which is an E1 analog, is administered. Peripheral vascular diseases में vasodilation के लिए we can give prostaglandin E1 and I2, and this is currently under clinical trials. एपोप्रोस्टिनॉल प्रोस्टासाइक्लिन की डेरिवेटिव है. प्रोस्टासाइक्लिन PGI2 को कहते हैं. इसकी सिंथेटिक डेरिवेटिव है एपोप्रोस्टिनॉल, विच इज़ सक्सेसफुली यूज्ड इन द ट्रीटमेंट ऑफ पल्मोनरी हाइपरटेंशन, और ये बहुत इंपॉर्टेंट MCQ है, पूछा जाता है अक्सर. इन GIT वी यूज misoprostol, which is the prostaglandin E1 analog for prevention of NSAID-induced ulcers. And I may we can use prostaglandins for the treatment of glaucoma, especially the prostaglandin F derivatives such as latanoprost. These are all the clinical uses of prostaglandins which we should be very fluent about because इनको बहुत commonly exams and vivas में पूछा जाता है. Side effects of prostaglandins are not generally asked because prostaglandins are locally produced compounds which are broken down immediately after their effect is produced. This marks the end of prostaglandins. It is a small topic, but nevertheless it is very important because there are parts that are described here which are not described elsewhere, especially in context with the NSAIDs and corticosteroids and phospholipases and cyclooxygenases. If you did find it helpful, please like it and subscribe and share. Thank you.